Okay, Melvin, so we're going to go ahead and begin with the abdominal exam. Before I begin, do you have any pain or any tenderness or anything that you've been noticing?
No,
Okay. Any abnormal issues with your abdomen or bowel or any acid reflux? Any pain with your bladder?
no,
No? Is your bladder currently full?
no.
Okay. So if it's okay with you, I'm going to go ahead and roll up your shirt just a little bit. Is that all right?
Yes.
Okay. So right now I'm just going to kind of inspect the overall abdomen area and the skin. Everything appears to be okay. I don't see any abnormal like pulsing. There's no apparent bulging or any signs of any masses or anything like that. I can tell that the stomach moves symmetrically with your rate of breathing. If it's okay, what I'm going to go ahead and do next is I'm going to go ahead and take a listen. Are you okay with that?
Yes.
All right. So the first thing I'm going to do is I'm just going to take a listen to your bowel sounds, okay? Okay, so your bowel sounds do sound normal. There's not hyperactive, so there's not more than 30 bowel sounds per minute, which is good because there are some pauses and then it does continue in all four quadrants, which is good because that lets me know there's nothing abnormal going on. The next thing I'm going to do, if you're okay with it, is I'm actually going to also try to listen to the aorta area, okay? So I'm going to do that with the same, with this first part of the diaphragm, and then I'll also listen with the smaller portion right here. That's the bell. Okay. So I don't hear any signs of any bruise or anything like that. Everything sounds okay with both ends. So I'm also going to take a listen to your spleen area and also to the liver, okay?
Okay.
Let's listen on this side, okay? Okay. And no signs of any rub or anything like that in the spleen or in the liver. So that's good. So that lets me know that there's no enlargement or anything like that. I'm also going to take a listen to your femoral arteries, okay? Just going to go ahead and feel around right here. Okay, same thing on this side. Sorry, I'm just going to lower this a little bit. Okay, and no signs of any bruise, there's no swishing or anything like that, so that's good. So the next thing I'm going to go ahead and do is I'm just going to go ahead and do a little bit of percussion, okay? So I'm just going to be doing some light tapping on the 4 quadrants of your bowel, okay? Okay. No signs of any dullness or anything like that, so that's good. The next thing I'm going to go ahead and do is mark for your liver, okay? Just keep breathing as normal. Okay. So I can kind of basically outline the area of your liver just by kind of hearing the sounds and being able to notice the difference of the dull sounds. So the next thing I'm gonna do is I'm also gonna look for some splenic dullness also, okay? So I'm gonna go right here on the 12th rib, and then I'm gonna go up to the 10th intercostal space, and I'm gonna try and do some percussion right here, okay? Take a deep breath for me and hold it in. Okay, good. So go ahead and release that breath. So when you took that deep breath in, I was able to hear a change in sound, which is good because that lets me know that there's no signs of splenic enlargement. So the next thing I'm going to go ahead and do is I'm just going to do some palpation, okay? So we'll start off with a light palpation, and once you kind of get used to that sense of touch, then we'll kind of go a little bit deeper if that's okay with you, okay? Let me know if you have any pain at all, okay? Any pain?
No.
Okay. Any pain here?
No.
Any pain here?
No.
How about here?
No.
Okay. If you're okay, I'm going to go ahead and go a little bit deeper. Is that okay with you?
Yes.
Okay. Pain here?
No.
How about here?
No.
Pain or dullness here?
No.
No tenderness?
No.
Any pain here?
No.
Okay. So the next thing I'm going to do is I'm going to try and feel for enlargement of the liver. So what I'm going to have you do is I'm going to have you take a nice big deep breath and then hold it in for me. So go ahead and take a big deep breath in and then take it out. Let it out. Okay. I'm going to do that one more time. Deep breath in and then out. I can't really feel too much, which lets me know it's not enlarged. Typically, it is okay to feel a little bit, but I didn't really feel too much there. We're going to go ahead and do the same thing on the side of your spleen, okay? Down and up. You take a deep breath in for me. And let go. And I don't feel anything at all there, so that's good. So that lets me know that there's also no enlargement of the spleen. So I'll go ahead and put this back for you. Do you have any questions or concerns?
No.
So everything seems about normal. All the bowel sounds seem fine. There's no tenderness or pain. There's no abnormal sounds that would let me know that there's any kind of enlargement or anything going on there. As far as the bladder, is everything okay? You
Yes.
said fine? Okay. All right. Thank you very much, Melvin.
Thank you.